I'm going to go ahead and start this morning. I want to say thank you to Lisa Bale. I thought her presentation this morning was really encouraging and inspiring for me. My name is Linda Fanning, and I am the Interim Chief Nursing Officer at Merrick Medical Center, and I've had the pleasure of being at Merrick since December, and it's been such an honor to be within the Bryan system and to meet the nurses and the staff and the whole community in Central City. But I want to give you a little bit of history real quick on the background of Merrick Medical Center and how we got to where we are today and where we're going in the very near future, which is very exciting for everyone. Back in 1936, the first hospital in Merrick County was Central City Community Hospital, and it opened its doors. And then in 1945, the hospital was renamed Cord Hospital, and it was relocated downtown Central City. In 1959, Litzenberg Memorial County Hospital came into being, and it was a 24 acute care bed hospital, and it had bassinets in the nursery, a delivery room, and an operating room. And in 1963, they expanded 7 private beds, 3 pediatric beds, and 2 4-bed wards, actually. And then moving forward in 2000, Litzenberg expanded crucial service areas and offered outpatient service clinics, long-term care, and assisted living services in the Merrick County. Litzenberg was designed as a critical access hospital in June of 2000 and licensed for 20 acute care beds. In 2013, Litzenberg Memorial Hospital entered into a management agreement with Bryan Health. And at that time, it was not until 2014 that the Longtree Medical Associates officially became part of the Litzenberg. After a successful 3-year management agreement, the process of forming a permanent partnership with Bryan began. On July 1st in 2017, Litzenberg joined Bryan Health's award-winning statewide network of doctors, hospitals, and medical providers. With this agreement, Litzenberg began operating under a new name, and that's when we received our name, Merrick Medical Center, and began embracing the commitment to the healthcare system within Merrick County at even a more extensive rate than they had before. This time next year, we'll be moving into our new hospital. If you've driven down Highway 30, you'll see the construction taking place. The pillars are up, and we are really excited about that. We're starting to gear up for that. We're starting to hire new staff for that. So this recruitment fair came at a very good time for us, and we're hoping that you will consider joining us and be a part of our community. And I'm going to hand this over to Jamie and to Misty and let them tell you a little bit about our open positions.
I'm Jamie. I have been a staff nurse here at Merrick for a little over a year now. And I am Misty Morris. I am the acute care ED trauma manager here at Merrick Medical. Yeah. So just a little bit about me. I am a Bryan Health College graduate. I graduated in December of 2019, took my NCLEX in January 2020, and I started working here at the end of January of 2020. I started out strictly doing floor nursing, med-surg patients, and in the year that I have worked here, I now have became charge nurse capable. I go back into the emergency room. We started taking COVID patients when the bigger hospital systems were getting overwhelmed. And so I owe that growth and all of that experience to this small critical access hospital facility that I love so very much. So Merrick is, you got anything to add on that?
No, go.
Okay. Merrick is just a 20-bed facility. Basically, to be a critical access hospital, you need a designation by Medicare and Medicaid. You have to be a certain amount of miles from another hospital. You have to have ER capability, at least 20, has to be 25 beds or less, right? Am I correct?
You are correct.
Okay, yeah. So, and some of the services that we offer here at Merrick Medical Center, we have inpatient rooms, we have 2 ER rooms, we do outpatient procedures. That hallway turned into our makeshift COVID hallway. We do outpatient surgeries, infusions. We have consultations that come during the week, like cardiology.
We're adding in urology. We have Dr. Bliss coming from Grand Island, who is ENT. We do nephrology, psychology, lots of breakout and telehealth services, as well as those doctors coming to the outpatient clinic and getting stuff rolling here for us.
Yes. And then among our patient population, we take swing beds, which is basically just an extended stay for patients who have the chance to work with physical therapy and occupational therapy. And then we don't have OB anymore, but that does not mean that we do not see our fair share of pediatric patients here. And we also see a good share of traumas and codes that come in as well. So,
and with that trauma, we did get our certification. Again, we are trauma certified level 4 here at Merrick Medical. We just did that in 2019, and we'll redo that again in 2 years, I believe. So we are definitely trauma certified. We are hooked up with the Bryan trauma surgeons, either through video or phone call. When those traumas come in, we are able to connect with those physicians, and we get people sent out from here straight to Bryan.
yes. So, I was asked to join this breakout session just to kind of share a little bit about myself being a new graduate nurse and having this facility and all of these managers take me on and help me learn and help me grow as a nurse. So the one thing that I love about this critical access hospital and rural nursing in general is that rural nurses are considered to be expert generalists. We know a little about a lot of things. We see everything come in. I've had anywhere between a newborn baby back in the ER, a isolation COVID patient down the hall, somebody who's receiving IV antibiotics, someone who is receiving a blood transfusion at the same time, and then another individual who is having a manic episode and needs their psychiatric meds restabilized. So you get it all in critical access hospital rural nursing. I think as a rural nurse, you definitely have to have a diverse set of skills. You have to be flexible, willing to participate and go the extra mile, because it is a camaraderie and a level of teamwork that I don't see in bigger, well, you do see them in bigger hospitals, but it's just more of an intimate setting here.
I agree.
Everyone is always open to help me anytime that I need support or ask questions. I have never felt like I couldn't ask either my coworkers, my manager, or even our PAs and our doctors as well. They are always willing to sit down and explain something to me if I have a question for them.
I think you're right on point. I think that the experience here shows the diversity in nursing. You have to be autonomous. You learn so much for so many different categories of the healthcare department. We're using critical thinking at every step. The positions that we offer here right now are a day shift full-time, 2 night shift full-time. We integrate you in slowly. We have an onboarding process that is set on an individual basis based on each nurse that applies. We develop those with you when you get here. We never want you to feel that you don't know what you're doing or that the steps we're taking are not, we're not going to throw you out on your own.
No.
Let's put it that way.
Yeah.
And Jamie's an excellent example of that. We will onboard you as long as it takes until you feel comfortable, and we'll get you in here and make sure you know what you're doing and grow.
And I think that is an important thing with rural nursing and either being a new nurse or even an experienced nurse is taking on things that maybe you're not comfortable with, but especially in this setting, you're always going to have somebody there who is willing to help you. You're never going to go into it alone, and you see a lot of different variety of skills to practice here and different situations that you're going to be in. I mean, you have anywhere from one night you're cardiac monitoring someone, doing a cardiac rule out, and like I said, having a newborn baby back in the ER, having to switch your assessment over to pediatric normal values and abnormal signs, therapeutic communication with the psychiatric patient that I was talking about earlier, keeping your main priority for that patient of safety and good quality care, patient-centered care. So
I also think that there's opportunities to grow here. Because we do so many different things, we have the outpatient services. Some of my nurses work down in the outpatient services department, and those outpatient services overflow into the inpatient side, where our nurses then continue that quality care down in the acute setting as outpatient services. We also have surgeries here. Our surgery manager, Brooke, who couldn't be here today, she's growing that full service line with new surgeries. We're doing pre-op and post-op as the day shift nurses. We train specifically for pre-op and recovery. We work closely with the surgeons that are here so that we can make sure that everyone's getting quality care. We're doing a lot of education right now, bringing in those new services of urology and ENT, just making sure that everyone feels comfortable taking those patients after surgery. I think it's just a really good opportunity to grow in nursing.
Yes, 100%. And it truly like takes a village here. I mean, all departments help out and assist when needed. I mean, our people in guest services who are totally amazing are not beyond answering a call light. Our maintenance guys who come in and scrape the ice off at 4 o'clock in the morning have even swept the snow off of my car so I don't have a mound of snow on it when I go to leave. It is just like an awesome place to be. Everybody's so great and so personable and super helpful. So I guess my main tip or word of advice for anyone would be, do not rule out rural nursing. A lot of people may think because it's small, we get bypassed, it's boring. That's definitely not the case. I mean, I've been in on traumas and codes and have felt supported since the beginning. I have gotten my trauma nursing certification, which a lot of nurses don't have depending on the specialty that you're in. PALS certification, ACLS, BCLS, you can expand your practice here and your skill set, I mean, indefinitely. Correct. Yes. And it is just as exciting. I mean, we see a lot of excitement here too. So just because it's small doesn't mean it's boring. I agree with that. But, do you have anything else you want to add?
Jamie and Misty, you guys did a great job talking and selling the great reasons why you'd want to be a part of Merrick. I definitely appreciate that. Just real quick, as far as your favorite part personally, would you mind adding a little bit about what you personally enjoy most about Merrick?
Absolutely. I, just as a background, I've been a nurse for 21 years. 16 of those were at a large hospital in Omaha. I came back here because I am from this area. My family lives in this area, so I actually came back from the big town just to be close to my family, and I think that's what we have here. It's a huge family. You get to know the patients way more intimately than you can at a large hospital. They come in, they connect with you. Someone walking down the hall that could be going for lab draw or physical therapy, they recognize the nurses, they know who they are. There's hugs in the hall. This is just a very intimate setting for healthcare. You know these people like the back of your hand, and you want to do everything you can for them.
Yeah. And my favorite part about this place, I mean, especially just being a new graduate nurse, would be the fact that everyone embraced me. Obviously, you come into this pretty green. I know you're fresh out of school and you know everything by the book, but you truly do your most learning in the actual care setting. And it was pretty scary taking on my first patient by myself, but like I said, everyone has been there to help me. The scary situations like codes, doing CPR, everyone just totally encourages me and supports me and tells me, you know, Jay, you got it, you got this. We review afterward and say, these are the things that you can improve on. We'll do better next time, but you're never going to be alone in it. So that's been my favorite part of working here. I couldn't imagine going to a big hospital and just not having the personability that you were talking about.
I'm going to add, just because everything that these wonderful ladies have said is true. There is a camaraderie here in the rural Merrick area that I've not experienced in my lifetime, really. I see it a lot when I do go to rural facilities, and there is a camaraderie that's, you know, everybody has to pitch in and they have to help each other and they've got each other's back. And I think you don't lose that when you're in a larger facility. It's just more apparent. And I feel like that is a good reason to try rural nursing. I think you get great experience, probably some of the best experience ever, because even as a nurse leader, you'll wear many hats in the rural area. And the nurses do get that cross training. They get all kinds of experiences, and they do get some one-on-one help from their leaders like Misty, who's got great clinical background herself and just really likes to grow and mentor her staff. So kudos to this group, and I'm just so privileged to be here with them. And I really hope that as we move into our new hospital, that the recruitment continues as it has.
Great. Well, it looks like we have a great team there at Merrick Medical, and excited to have you join with us today and share this information that we can cascade out to others that want to be a part of your team. So thank you for spending this time with us today.
Yeah, thank you.
Thank you.